Welcome to the deep dive. Today we're plunging into a topic that's, well, often insidious but incredibly important for anyone connected to horses: toxic liver disease or toxic hepatopathy. You've shared some comprehensive sources, and our mission for this deep dive is really to extract the most critical insights, helping you understand this complex condition, recognize its surprisingly subtle signals, and grasp the vital role of prevention.
What's crucial to grasp right from the start, I think, is how the horse's own biology, its remarkable liver, actually makes this disease so challenging to spot early. We'll be connecting the dots between the liver's incredible capacity to compensate and the delayed onset of serious clinical signs.
Okay, so let's dive into the core of this then. What exactly is toxic hepatopathy, and why is it such a formidable challenge to spot? We're going to explore what causes it, how it subtly manifests, the detective work involved in diagnosing it, treatment strategies, and maybe most importantly, how we can actually prevent it.
At its core, toxic hepatopathy is liver damage caused by various chemical agents or toxins. It's distinct from, say, infectious diseases. The equine liver is a massive, hard-working organ, absolutely vital for detoxifying waste, storing nutrients, synthesizing proteins. It's truly a powerhouse.
And it sounds like it's right on the front lines for any ingested toxin.
Exactly. What's truly insightful here is understanding the liver's direct pipeline from the gut. Approximately 70% of the blood flowing to the liver comes straight from the gastrointestinal tract and spleen via the hepatic portal vein. This first-pass effect means that ingested toxins hit the liver first and hardest, often in, well, undiluted concentrations. It's a fundamental vulnerability that makes this organ a primary target for toxic damage.
But you also mentioned the liver's remarkable capacity. How does that play into this whole picture? Does it protect the horse or actually make things worse in a way?
It's a bit of a double-edged sword, really. The equine liver possesses an amazing ability to keep working and even repair itself, even when seriously damaged. It can compensate for significant insult, often delaying overt clinical signs until 60% to 80% or even more of the liver mass is compromised. This is what leads to that silent progression of the disease. It's incredibly resilient, but that resilience, it can mask serious problems.
So it's like a horse version of a silent killer. You don't know it's there until it's really taken hold. That's a truly frightening thought for anyone who loves their horse. What does that silent progression mean for someone trying to spot this in their horse day to day?
It means the early signs are frequently quite vague and nonspecific. We're talking lethargy, depression, decreased appetite, progressive weight loss, maybe mild or recurrent colic, and intermittent fever. These symptoms are common to a whole host of equine health problems, making them easily overlooked or misattributed to something less severe. This built-in delay means that by the time definitive signs of liver dysfunction become apparent, the disease is often already well established. It may have progressed to an advanced, potentially irreversible stage. So what appears to be a sudden onset of severe signs is frequently just a manifestation of this underlying, long-standing pathology, finally overwhelming the liver's remarkable, but ultimately finite compensatory mechanisms.
That makes prevention sound even more critical, doesn't it, if you can't rely on spotting early symptoms easily? So if the signs are so subtle early on, understanding the causes becomes absolutely paramount. What are the main categories of toxins we're looking at here?
Well, the causes are numerous, and they can vary geographically, but primarily they fall into two main camps: plant and mycotoxin-induced, and then drug and chemical-induced categories. Okay, so for plant and mycotoxin-induced hepatopathy, pyrrolizidine alkaloids, or PAs, are a globally significant class of plant toxins. They're actually recognized as the most common cause of liver toxicity in horses in the UK, for instance, found in plants like ragwort, groundsel, fiddleneck, those sorts of things. The toxins get absorbed, converted to reactive pyrroles in the liver, which then inhibit cell division. This leads to these abnormally large cells called megalocytes that eventually die off. The end result is irreversible liver damage and cirrhosis.
And what's really critical here, as I understand it, is that these plants are often unpalatable when fresh, but when they wilt or dry out, especially if they get baled into hay, they lose that bitter taste and become highly palatable, so the horse eats them readily.
Exactly. That's a key mechanism for poisoning, bypassing the horse's natural aversion. It's a huge hidden danger in hay.
Wow. That's something every owner needs to know.
Absolutely. Then we have cocklebur, particularly the seedlings, the little two-leaf seedlings. They contain carboxytetractyloside. This toxin rapidly inhibits cellular energy production, leading to acute signs like depression, weakness, convulsions, and sometimes even rampant death within hours. It's very fast-acting. Another one is cline grass. It contains sapogenin, which can cause jaundice, photosensitization, and colic. And a surprising detail here is that the photosensitization linked to clean grass can specifically affect the coronary band, potentially leading to lameness.
Lameness from a liver issue. That's unexpected.
It is. Then there's Alsike clover, implicated in photosensitivity, often called dew poisoning, and a more severe big liver disease. The exact toxic principle isn't fully known, but a fungus on the clover is suspected. Blue-green algae or cyanobacteria in those harmful algal blooms you hear about. They can produce potent hepatotoxins like microcystins. Ingestion can lead to rapid death. Horses are often found deceased near the contaminated water source.
That's terrifying.
It is. And aflatoxins. These are mycotoxins from Aspergillus molds that can contaminate grains like corn and oats, especially in drought conditions or warm, damp storage. A really critical aspect here is that toxic concentrations can be present without any visible mold growth, so you can't always just look at the feed and tell. Acute signs can be severe, while chronic exposure leads to more subtle, progressive signs like weight loss and jaundice. And finally, amanitin, those highly potent toxins in certain mushroom species, which can just pop up suddenly in pastures.
Okay, so that covers the plants and molds.
Yeah.
What about medications and other chemicals? What risks do they pose to the liver?
Right. Common medications like NSAIDs, that's non-steroidal anti-inflammatory drugs, think phenylbutazone, flunixin, those kinds of things, and corticosteroids carry a risk, especially at high doses or with prolonged use. The liver's central role in drug metabolism means it's constantly exposed,
Yeah.
Its detoxification pathways can simply get overwhelmed.
So even common drugs need careful management.
Definitely. Then there's iron overload. This can happen from overzealous oral iron supplements, which, by the way, horses rarely need, or from chronic ingestion of water contaminated with high iron levels. And in newborn foals, even tiny amounts of oral iron before they get colostrum can actually be fatal.
Really? That's critical for breeders to know.
Absolutely. And finally, Thaler's disease, also called acute serum hepatitis. It's uncommon, but it's a severe acute hepatitis. This brings up a really important connection. It's strongly associated with the administration of an equine origin biologic product like tetanus antitoxin or equine plasma.
Yeah.
Typically occurs 4 to 12 weeks after that administration. This represents a direct iatrogenic risk, meaning a risk from the medical treatment itself. It often progresses very rapidly and has a high mortality rate.
Okay, so we've talked about the silent progression and this huge array of culprits. How do these conditions actually manifest in a horse, particularly as the disease advances? What specific signs should someone be really looking for, and now that we know what to watch out for?
Well, initially, you'll still see those non-specific signs we discussed. Dullness, lethargy, maybe decreased appetite, progressive weight loss, mild recurrent colic. As we said, easy to miss or misattribute.
Right, the vague stuff.
Exactly. But as liver damage advances, more specific and severe clinical syndromes start to emerge. Jaundice, or icterus, that classic yellowing of the mucous membranes, like the gums and the whites of the eyes, and sometimes the skin. It's more common in acute cases or when bile flow is impaired.
Okay, yellowing is a big flag.
It is. Then there's hepatic encephalopathy. This is a severe neurological syndrome caused by neurotoxins, like ammonia, building up when the liver fails to remove them from the bloodstream. The signs can vary widely, from profound depression and lethargy to really bizarre, aggressive, or even, maniacal behavior. Specific signs include things like head pressing against walls, compulsive circling, aimless walking, and persistent yawning.
That yawning is interesting. And you mentioned earlier, what stands out for you as an owner potentially missing a key sign is increased friendliness. I can just imagine someone thinking, oh, my horse is just being extra affectionate today, and not realizing it's a critical sign, delaying vital veterinary intervention for a life-threatening condition. That's truly alarming.
It really can be misleading. Another very distinct skin manifestation is photosensitization. This happens when the liver can't properly metabolize phytoerythrin, which is a chlorophyll breakdown product. It accumulates in the skin, and then upon UV light exposure, it causes intense itching, reddened skin, ulceration, peeling. These lesions are most prominent on non-pigmented, light-colored, or hairless areas. Think the lips, white face markings, lower legs, as a highly specific indicator of liver dysfunction.
So white markings suddenly getting sore and peeling could be a liver sign.
It definitely could be, yes. Other signs might include altered fecal consistency, like diarrhea or constipation, sometimes a tendency for bleeding because clotting factor synthesis is impaired, laryngeal paralysis, which leads to that loud honking breathing sound, especially in ponies, can occur. And in rare instances, ventral edema swelling underneath or fluid building up in the abdominal cavity.
So quite a range of signs once things get serious. When a horse starts showing any of these more definitive signs, what's the diagnostic process like for a vet? How do they confirm it is liver disease and, crucially, try to pinpoint the exact cause amongst all those possibilities?
Yeah, a definitive diagnosis requires a systematic multimodal approach. It's like detective work. Comprehensive clinical examination and taking a really detailed history are paramount. Absolutely essential. The history should meticulously ask about the horse's access to potentially toxic pastures or contaminated feed, any recent or prolonged administration of medications that could affect the liver. And it's crucial to ask about previous administration of those equine origin biologics, like tetanus and a toxin, especially within that 4 to 12-week window before symptoms, given the link to Thaler's disease. Also finding out if multiple animals are affected in a herd that can provide really crucial clues.
Okay, history first. Then what? Blood tests.
Yes, laboratory diagnostics are key. We look at liver enzymes as indicators of damage. Enzymes like sorbitol dehydrogenase, SDH, and glutamate dehydrogenase, GLDH, are quite liver-specific. They tell us about hepatocellular damage. SDH is highly specific, but it breaks down quickly, so it's best for immediate in-house analysis. GLDH is also liver-specific, but more stable, better for samples sent out to external labs. Other nonspecific enzymes like AST and ALP also provide information, but need careful interpretation alongside the other tests.
So you're looking for damage signals. What about how well the liver is actually working?
Right, that's where liver function tests come in. These assess the liver's ability to do its job. Measurement of serum or plasma bile acids is generally considered the most reliable test for assessing liver function. Elevated levels, especially above, say, 30 amantol, can be an early predictor of liver failure. Elevated blood ammonia levels are a key indicator of hepatic encephalopathy, showing the liver's impaired ability to convert ammonia to urea. Then, general blood work and a coagulation profile provide a broader picture, assessing things like blood glucose. Albumin levels, though albumin has a long half-life, so it might stay normal even in chronic disease, and clotting factors, which can be impaired in severe liver failure.
Okay, blood tests give a lot of information. What about seeing the liver itself?
That's where diagnostic imaging comes in, particularly ultrasonography. It's often the procedure of choice for evaluating the liver's size and appearance, detecting structural changes like fibrosis or tumors, and, importantly, ultrasound is used to guide liver biopsies safely. Increased echogenicity, meaning it looks brighter on the ultrasound, can indicate fibrosis or biliary hyperplasia, which often points towards a poorer prognosis.
And the biopsy itself, that sounds like the ultimate step.
It really is. A liver biopsy is considered the definitive means of diagnosing liver disease. It provides critical information you just can't get from other tests. It helps confirm primary liver disease. It can provide an etiological diagnosis, like showing those specific megalocytes for pyrrolizidine alkaloid poisoning or changes typical of cholangiohepatitis. It also helps assess how chronic the condition is, and it generally has greater prognostic value than other tests for determining the chances of survival.
Okay, so after all that diagnostic work, if a horse is diagnosed with toxic hepatopathy, what are the treatment options? What can actually be done at that point?
Well, the treatment is primarily focused on 2 critical steps. First, you absolutely have to eliminate the source of the toxin. Second, provide comprehensive supportive care to give the liver the best chance to regenerate. Unfortunately, specific antidotes for most hepatotoxins in horses are rarely available. There's no magic bullet usually.
Right. So stop the poison first.
Exactly. That's the most immediate and critical step. It might mean removing horses from contaminated pastures, rigorously inspecting and changing feed sources, maybe switching hay suppliers, or it could mean discontinuing any medications that could be damaging the liver. And for those plant toxicities, remembering that dried or wilted plants in hay are often more palatable than fresh ones is really key. And looking back to Thaler's disease, that association with equine biologics highlights the importance of vaccination, specifically tetanus toxoid vaccination, to prevent the need for emergency antitoxin administration in the first place.
Prevention as part of treatment, in a way.
In a way, yes. Then comes supportive care. This aims to stabilize the horse and create the optimal conditions for liver recovery. This usually involves fluid therapy to correct dehydration and electrolyte imbalances, often supplemented with glucose to help reduce blood ammonia levels and provide energy. Nutritional support is absolutely paramount. Offering highly palatable, small, frequent meals, especially those rich in easily digestible carbohydrates, is important. You want to reduce the protein load on the liver sometimes. For hepatic encephalopathy, sedation might be needed just to manage the dangerous behaviors, and oral medications like Laxalose or certain antibiotics can help decrease ammonia production and absorption in the gut.
Are there any specific drugs that help the liver itself?
Well, pharmacological interventions might include corticosteroids, sometimes used cautiously for liver inflammation. Antioxidants like vitamin E, vitamin C, and supplements like milk thistle are commonly used for their potential hepatoprotective properties. Antibiotics are prescribed if a secondary bacterial infection is suspected, which can happen. But as I mentioned, specific antidotes are very limited. Detoxification strategies mainly focus on preventing further absorption if the ingestion was very recent, maybe using adsorbents like activated charcoal or laxatives, but the window for that is often very small.
This whole deep dive really hammers home how challenging this condition can be once it's established, especially with that silent progression making early detection so hard. So what does this all mean for prevention? What are the practical steps an owner can take to stop this happening in the first place?
Prevention is absolutely paramount, you said it, because many forms of liver damage are essentially irreversible by the time significant clinical signs become apparent. It really requires a multifaceted approach. Vigilance on several fronts.
Like pasture management.
Exactly. Environmental and pasture management is huge. Horse owners need to be knowledgeable about common hepatotoxic plants in their region, things like ragwort, cocklebur, Alsate clover, cling grass. These must be regularly identified and removed. And crucially, disposed of properly away from livestock, because remember, they become more palatable when wilted or dried. Ensuring there's plenty of high-quality, abundant forage available also helps, as horses are less likely to browse on unpalatable, toxic plants if they have good stuff to eat. And monitoring natural water sources for those harmful algal blooms, especially in hot weather, and fencing them off if necessary, is also critical.
Okay, pasture safety. What about feed?
Feed management is the next big piece. Always try to purchase feed from reputable sources. Store it properly cool, dry conditions to prevent mold growth and mycotoxin formation. Rigorously inspect baled hay for any dried toxic plants mixed in. If there are any concerns, feed samples can be sent for laboratory analysis for mycotoxins like aflatoxins, even if you don't see any visible mold. Also, avoid excessive or inappropriate iron supplementation. As we mentioned, iron deficiency is actually rare in horses, and too much iron can be dangerous for the liver.
Right, don't supplement what's not needed. And what about drugs?
Judicious drug use is vital. Veterinarians play a crucial role here, obviously, by administering medications with potential liver toxicity at accurate doses and for the shortest effective duration possible. Avoiding the concurrent use of multiple NSAIDs, for example, is generally important practice.
Makes sense. And finally, you mentioned vaccination.
Yes, vaccination protocols play an indirect but important role. Maintaining an up-to-date core vaccination program indirectly helps prevent some forms of toxic hepatopathy. For example, regular vaccination with tetanus toxoid is highly effective and provides reliable long-term protection. This minimizes the need for that emergency administration of tetanus antitoxin, which, as we discussed, carries that significant risk for Thaler's disease.
Wow. Okay, we've really explored toxic hepatopathy in horses today. From liver's incredible, but deceptive reserve capacity to the incredibly diverse array of toxins and that meticulous diagnostic journey, it's crystal clear this is a condition that demands our heightened awareness and vigilance.
Indeed. And if we connect this to the bigger picture, the prognosis for horses diagnosed with toxic hepatopathy is highly variable. It really depends on the specific toxin involved, the severity of the damage, and how quickly intervention happens. Cases that show moderate to extreme fibrosis or scarring on biopsy often carry a guarded to poor prognosis for long-term survival, which just really underscores the importance of continuous vigilance in trying to catch things early, or better yet, preventing them.
So what does this all mean for you, the listener? It means being informed, definitely. Being observant of those subtle changes in your horse. And taking proactive steps in pasture and feed management and understanding the risks associated with medications. These aren't just, abstract veterinary concerns. They're deeply embedded in daily horse care and management. So here's something for you to mull over after this discussion. How might increased climate variability, weird weather patterns, droughts, floods, and ongoing changes in agricultural practices potentially alter the landscape of toxic plant distribution and mycotoxin exposure risks for horses in the coming years? And what might that mean for our proactive prevention strategies, perhaps on a more global scale?
That's a very important question for the future. Thank you for joining us for this in-depth look into understanding and preventing toxic liver disease in horses.